Adult acne, how to deal with it. Hormone-producing organs are primarily responsible for the outbreaks of pimples. Hence, enough care has to be taken to maintain them well to avoid skin disorders. Acne is common in teenage and during pregnancy. When it occurs on adults, it is a very stressful situation for them, as the society does not approve acne or adults. Some adults feel so embarrassed that they want to hide acne from other people's sight. Studies have shown some growing evidence on acne, that it can be a hereditary disease too apart from occurring due to hormonal imbalances. It is due to oil production and mismanagement of dead cells exfoliation. Acne lesions in adults are normally seen on the face, but might also occur anytime on the chest, neck, back, scalp, legs, upper arms and even shoulders. Adult acne is very persistent when compared to teen acne, as acne seen in teens subsides over time when the hormones get adjusted. Another major drawback of adult acne is that it leads to permanent scarring. Key factors that contribute to adult acne. Hormones are considered as the main culprit and mainly cause skin eruptions or outbreak of acne. But, has anyone thought about the organs that produce the hormones? The actual fact is that the kidneys, liver and skin are the important organs involved in eliminating impurities and waste particles from the body. If any one of the organs does not work properly and does not eliminate waste out the body, it might result in acne in adults. Acne or the skin eruption is the first symptom of failure these organs are facing. To facilitate the elimination of waste from body water is very important. When water is taken in good quantities, the bowels are cleared and the blood too gets rid of its toxic elements. If water content decreases, the skin might not do its function of eliminating wastes, or the lungs might not be able to oxygenize the blood due to the impurities of air as breathed and retained in it. Hence, the factors for acne may be air, food, emotional stress, water etc. Natural adult acne treatments. The wastes from the body should be eliminated properly. To facilitate it, the person should be exposed to pure air, water, natural food habits and foods rich in antioxidants. A natural face wash made up of clean, warm water with lemon juice can be used to pamper the skin. The lemon has the ability to reduce oil from the skin, hence minimizing acne in adults. Fiber-rich food helps in the removal of toxins and wastes from the body by facilitating the bowel movements. Also, when using cosmetic products, care needs to be taken not to use oil-based cosmetics. Adult acne, nothing to be embarrassed about. Adult acne is not something to feel embarrassed about. Though the general notion is that acne and pimple outbreaks are for prepubertal and teenaged populations, adult acne is not unusual. A majority of adults, who were lucky to be acne-free during their teenage years and who saw the desperation of their peers trying to combat acne, feel mortified when they find that just when they assumed they were free of acne forever, they have become afflicted by adult acne. Most of the adults are confused and embarrassed. They wonder, isn't acne an adolescent problem? But the truth remains that adult acne is more widespread than imagined. Statistics show that in the United States alone, nearly 40% of all acne cure products are purchased and used by adult acne sufferers. What is the reason behind adult acne? Well, it is not one but many. However, the most universally attributed cause, that of bad personal hygiene, is a myth. Nearly all acne cases, even adult acne, are a direct consequence of blocked pores on the skin or hormonal imbalances. Faulty closing of facial hair ducts or infection of the oil glands are a probable cause of adult acne. The good news is that acne can be cured to a greater or lesser degree. The bad news is that most adults, in their zeal to overcome the embarrassment of an adult acne outbreak, try the first remedy they can lay their hands on from their neighborhood drugstore. Little do they think that this could do more harm than good to their acne problem. The remedies found over the counter cater to acne problems of the majority of the younger populations. These medications and remedies might not have the potency or the capacity to deal with adult acne because the reasons of which may vary to a great degree. Adult acne demands tougher remedies despite the fact that adult acne is no different from regular acne. So what should be the first step to cure adult acne? A good idea is to consult the dermatologist to determine the underlying cause of what caused adult acne. The next step after the diagnosis is done is to use simple prescription drugs to eradicate the acne problem forever. However, there is one important piece of advice. All adult acne sufferers need not be embarrassed about their problem. Like I stated above, adult acne is commoner than imagined. So which option do you feel is better? To make that one visit to the dermatologist to do away with your acne problem, or to spend a fortune at the local pharmacist in trying to find the elixir for acne in addition to the fear and worry that comes with it? Think about it. The choice is yours. Adult acne, causes and cures. Almost everyone will have some form of acne in their lives. Most people get acne during their teenage years, associated with the massive hormone changes that occur during puberty. It is equally common to men and women, and usually outbreaks occur on the face. However, acne can strike at any stage in adult life, and outbreaks can appear not only on the face, but on the back, neck, arms and legs. The good news is that the situation regarding acne and acne skin care is by no means hopeless. Acne treatment exists. And while it might not be realistic to expect some sort of magical acne cure, there are ways to effectively tackle the problem. Acne skin care, adult acne, infant acne, acne cure, cause of acne, pimples, zits, acne treatment. What causes this condition that seems to chip away at the very foundations of self-esteem with an almost malevolent intent? The myth is that once teenagers cross the threshold from adolescence into adulthood, the anguish caused by acne will be permanently left behind. The reality is that there is no guarantee that adulthood will offer the safe, acne-free haven that so many teens long for. Statistics indicate that 25% of the male population is plagued at some point by adult acne, while 50% of females will similarly find themselves contending with the condition as adults. It seems that no one is exempt. Infant acne can appear on the faces of babies who are only 3 or 4 weeks old, or even on the faces of newborns. Since so many are afflicted, adult and child alike, there's an obvious need for real information on acne skin care that cuts through all the myths and separates fact from fiction. Let's begin at the beginning. Sebum is the natural oil produced by the skin's sebaceous glands. For reasons that aren't fully understood, the pores of the skin can become plugged with sebum, and once plugged, bacteria and dead cells can become trapped in the pores, resulting in the lesions common to acne. Acne can be defined as a condition describing blocked skin pores that result in lesions. The most common lesions are called comedones. There are 2 basic varieties of comedones, whiteheads and blackheads. A whitehead is an occluded pore that has begun to bulge outward from the skin due to dead skin cells, bacteria, and other contaminants that have become trapped inside. This bulging dome shape often assumes a white appearance. Blackheads are simply comedones that have opened, exposing the dark follicle mass inside. Acne comedones are often referred to colloquially as zits or pimples. Microcomedones are a less common form of acne lesion, sometimes referred to as papules. These are basically small comedones that form from localized cellular reactions to the processes that cause acne. They usually occur in clusters and are sometimes too small to see. They can be felt as a series of little bumps along the skin surface. In more severe forms of acne, cysts, pustules and nodules can form. A pustule is like a normal comedone, but larger due to a higher amount of dead white cells, or pus, trapped inside the plugged sebaceous follicle. Nodules are a more severe form of papules, extending deeper into the skin tissue and resulting in large raised lesions that are usually inflamed and painful to touch. Finally, cysts are very large fluid-filled sacs that can result from pustules or nodules. Though none of these forms of acne are dangerous or life-threatening, they can leave scars and are sometimes very disfiguring. What causes acne? This is a question that scientists and doctors still haven't been able to completely agree upon. Today, most theories seem to point to a combination of factors that include genetics, hormone changes, and stress. For years it was thought that diet was a strong component to acne, but most evidence today suggests that hormones and stress are more likely to be the culprits. Almost everyone will have some form of acne in their lives. Most people suffer from outbreaks of acne during their teenage years. These outbreaks are associated with hormone changes that occur during puberty. It is equally common to men and women, and usually outbreaks appear on the face. However, acne can strike at any stage in adult life, and outbreaks can appear not only on the face, but on the back, neck, arms and legs. The good news is that the situation regarding acne and acne skin care is by no means hopeless. Acne treatment exists. And while it might not be realistic to expect some sort of magical acne cure, there are ways to effectively tackle the problem. Once you can find easy-to-implement acne tips and information at websites like www.acneskincareatoz.com, there's a good possibility you'll be able to minimize your breakouts or avoid them altogether. Adult acne, frustrating problem with no easy answers. What are the reasons that more and more adults are suffering from acne? That's probably related to the more varied and volatile hormone changes that accompany the adult physiology and lifestyle. Also, subtle early premenopausal changes in estrogen and testosterone may contribute. Women are subject to more stress than perhaps at any other time in history. There are more concrete demands and more mixed messages demanding personal and professional perfection. The price is. What are the reasons that more and more adults are suffering from acne? That's probably related to the more varied and volatile hormone changes that accompany the adult physiology and lifestyle. Also, subtle early premenopausal changes in estrogen and testosterone may contribute. Women are subject to more stress than perhaps at any other time in history. There are more concrete demands and more mixed messages demanding personal and professional perfection. The price is often physical and emotional exhaustion and emotional stress. How is it possible for the skin to not respond badly as well? The final basic cause of adult acne is the same, abnormal response of the follicle lining cells to androgens. However, there are many more potential and identifiable causes in women, i.e. hormone medications, menses, pregnancy, personal care. The following regimen is one which is typically recommended to varying degrees of adult acne. Non-comedogenic soaps, cosmetics, etc. Many skin cleansers, makeup, etc. actually leave residues which block pores, and can make acne worse. The products which are used should state that they do not exacerbate acne. Some have recommended a very inexpensive, natural topical antibiotic. Placing 1 teaspoon of essence of lemon oil, found at supermarkets, into 4 ounces 120 cc of liquid soap. This is used for cleansing the skin. Essence of lemon has antibacterial properties. Topical antibiotics. Several antibiotics are prescribed for adult acne twice daily. They usually come in a roll-on type bottle. Topical vitamin A acid cause peeling of the superficial layer of the skin to lessen new comedone formation. Quite effective. Face gets raw if used too much. Must use a sunscreen. Takes 4 to 6 weeks of consistent use to attain benefit. Facial cleansing. People with adult acne usually have very clean skin because attention they give to this area. UV light therapy should be done with great care and under the supervision of a dermatologist. Oral antibiotics, tetracyclines or erythromycin are most commonly given by mouth for moderate to severe acne in adult. More expensive antibiotics are not necessarily any better than plain tetracycline. Tetracyclines work very well, however, because they can discolor new bone formation, they are contraindicated in youth who have not completed their permanent teeth, as well as pregnant and nursing females. Isotretinoin Accutane is indicated in only the severest adult acne cases. It is highly effective at reducing sebum production, comedone formation, inflammation, etc. However, it can cause severe birth defects if taken while pregnant and runs the risk of toxicity, requiring certain laboratory monitoring prior to and during therapy. It usually needs to be taken for at least 20 weeks. All other adult acne therapy is stopped while on isotretinoin. In general, it's not how you wash, what you eat, what you drink, or impure thoughts. The over-the-counter, television, and internet miracle cures are too good to be true. Really. You need real therapy that can clear your skin. Adult acne. Causes of adult acne. Most of us believe that acne is for teenagers. That is true to a large extent, because the hormonal changes during teenage causes acne. But acne does occur in adults and sometimes it is severe. Find out more about it so that you can prevent it. Number 1. Acne in adults. Causes. Sometimes many adults who have no acne in their earlier years get acne. It is as if since acne had spared them during adolescence, it comes during the adult years. Hormonal changes during adulthood may cause more sebum production and result in acne. The hormonal changes may be due to pregnancy in women, birth control pills, etc. Some athletes and others take anabolic steroids to build their body. That can cause adult acne. Medicines such as lithium, medications for tuberculosis, etc. can also cause adult acne. You will need to talk to your doctor and find out if any medicine is the cause. Number 2. Acne mechanica. If you carry some object, or wear very tight clothing of synthetic material in such a way that causes pressure and friction on the same place for long, you may get acne during adult years. Number 3. Chloracne. Working with chlorinated solvents can cause acne. It is called chloracne. Number 4. Acne in adults. Treatment. Adult acne is more difficult to treat than the acne that occurs during adolescent years. Please follow your doctor's prescription regularly and get rid of adult acne, otherwise it will not only affect you psychologically but also cause lifelong scars. This article is only for informative purposes. This article is not intended to be a medical advice and it is not a substitute for professional medical advice. Please consult your doctor for your medical concerns. Please follow any tip given in this article only after consulting your doctor. The author is not liable for any outcome or damage resulting from information obtained from this article. Adult acne information. Acne also afflicts adults. This article discusses more on this type of acne. A common misconception about acne is that it only afflicts teens and people in the adolescent age group. However, the truth is that a large number of adults do suffer from it. This leads to physical, psychological, and social effects on persons suffering from acne. These effects can be long-lasting and cause problems. With adults, acne leaves behind permanent and ugly scars since as the skin ages and loses collagen, it takes longer for the scars to heal. It may be hard to diagnose psychological effects due to common misconceptions that accompany them. For instance, it would be logical to say that the psychological effects of adult acne is easier to deal with since the person has matured and is not prone to teenage tantrums. However, in actual reality, the psychological effect in adults may be even worse, since this is a condition perceived to be specific to teens. Nowadays it is easier for adults to seek treatment from dermatologists as acne continues being recognized as a problem not confined only to teens but also to adults. Sales of over-the-counter treatments have increased as well as awareness about adult acne. Research into adult acne has been extensively applied to determine its causes and effects on older patients. This directly leads to increased awareness about the condition and makes it easier for more people to seek treatment. Nowadays, information about the condition is readily available from the web, medical journals, and publication. This means that the public can better understand it and how to combat it. More care is also given to the psychological effects it has on adults. Remember that they, just like teens, are affected by people's attitudes towards them and how they are perceived. In summary, the key to treating this affliction is to understand what causes it, knowledge about it, and how to treat its physical manifestation means that the social and psychological problems can be treated as well. Adult acne solved. Acne has always been a dreaded occurrence in our life. Most of us have carried this burden in our teenage years, and after almost 7 teenage years we think we are finally home free. Then one morning in your 26th, 27th or even 28th year of your existence you wake up with a huge zit on your face. And even worse, sometimes it is not just 1 but 2 or even 3 or even 4. And they just keep on sprouting like weeds in an inhibited garden. So acne has always been a dreaded occurrence in our life. Most of us have carried this burden in our teenage years, and after almost 7 teenage years we think we are finally home free. Then one morning in your 26th, 27th or even 28th year of your existence you wake up with a huge zit on your face. And even worse, sometimes it is not just 1 but 2 or even 3 or even 4. And they just keep on sprouting like weeds in an inhibited garden. So you wonder, I'm already an adult, so why? Adult acne is more common than we thought. Almost 5% of adults have adult acne, mostly in their 20s, 30s and even 40s and beyond. Adult acne can be found in the face and sometimes even on the neck and on the chest and back area. There are many reasons for the occurrence of these devils incarnates, and we will enumerate them here plus ways on how to outsmart them. Adult acne source number 1, those pesky hormones. And we all thought we are done with having problems caused by them. Apparently, they still have a last attack. Experts still can't pinpoint the main reason why our oil glands are more prone to breakouts because of hormonal shifts in this age line. Unfortunately, these up and down hormonal shifts are the main culprit in adult acne. But fortunately, there's an easy cure for these shifts, and that is the common birth control pill. But take note that this is not applicable to you if you are pregnant. For stubborn and hard-to-kill zits, you may also use medication that has the ingredient retinoids that can help unclog those pores. If still doesn't work, then it's high time to up your ammunition. Use antibiotics, maybe topical or even oral, to reduce the swelling. Adult acne source number 2, stress. Stress is also a major source of adult acne. But we can't help it, can we? Our world is full of stress-inducing situations and things that it is already a part of our daily lives. We have bills to pay, kids to feed, and a house to clean. So much stress we endure in a day that it results to the dreaded adult acne. This happens because stress triggers the body to secrete cortisol that results in the secretion of more hormones, thus resulting to zits. So what do we do when the bump pops? Relax. Do some distressing. Go on a vacation or just spend a day doing nothing. Eat right, sleep right, and do your exercise routine regularly. If your darn acne are still there after doing these things for a month or two, then it is high time to see your dermatologist for some treatment and prescription. Adult acne source number 3, daily grooming products. It is a fact that as we grow older we tend to become more vain, especially in our 20s to 30s when we are still finding our ideal mate. We tend to use a lot of products to make ourselves more attractive to the opposite sex. Unfortunately, this only results to adult acne, as these products tend to block pores, which can result to zits erupting like crazy in our pretty little faces. How ironic, isn't it? We bought and used these products to make ourselves more pretty, only to have these little craters embed in our face. So what to do? Simplify. You don't need all these products to make yourself pretty. Just use basics like moisturizer, cleanser, and sunblock. Purchase cosmetics that are non-comedogenic and make sure that they are oil-free, especially your moisturizer. And always remember your acne 101, do not touch your face or rest your pretty little chin in your grubby little hands. Adult acne treatment, what you should take care of. Just when you thought you'd finally got through all the skin problems related to puberty, you wake up one day and find acne. If you ask a dermatologist, you will find out acne is not just a problem for teens. Fortunately, there are some treatments that will help you fight adult acne successfully. Adult acne facts. Doctors say adult acne is a common problem, but unfortunately an under-recognized one. Most people think acne is just for kids, but it can happen in later years. Just when you thought you'd finally got through all the skin problems related to puberty, you wake up one day and find acne. If you ask a dermatologist, you will find out acne is not just a problem for teens. Fortunately, there are some treatments that will help you fight adult acne successfully. Adult acne facts. Doctors say adult acne is a common problem, but unfortunately an under-recognized one. Most people think acne is just for kids, but it can happen in later years too. It is more common in women than in men. Statistics show that acne affects about 25% of all adult men and 50% of all adult women at some point during their adult life. At the bottom of acne lies the pimple, which doctors call comedo. A pimple is a plug of fat, skin debris and keratin stuck in a hair duct. When it is open, we call it a blackhead, and when it's closed over, a whitehead. Whiteheads can cause the walls of the hair duct to rupture, leading to redness, infection and cysts of acne. Many people think that acne is a result of poor hygiene, but this is not true. Both adult and teen acne are caused by a combination of many factors, such as excess oil production, faulty closing of the hair duct or infection. Washing your face gently only twice a day is actually much better than washing it more often. Adult acne treatment. You can choose between an adult acne treatment in a dermatologist's office or at home. However, squeezing pimples at home often leads to infection and scars. Squeezing pimples is also a very effective way to get your acne to spread. Doctors, on the other hand, use special sterile instruments to prevent infection, scarring and acne spread. Another solution is to check your local drug store for adult acne treatments. If you've ever tried this, you know it's loaded with such products. With so many options available, choosing the right adult acne treatment can be quite difficult. A great progress in adult acne treatment has been the producing of the topical retinoid acid, a modified form of vitamin A. Improved versions of this medicine greatly reduce the irritation it can cause. Other acne treatments fight against different causes of acne. They are sometimes used in combination. Such acne treatments include azelaic acid cream, benzoyl peroxide, alpha-hydroxy acids such as lactic acid, glycolic acid and gluconic acid. Antibiotic pills, if used unwisely, they can lead to antibiotic resistance. Topical antibiotics, gels, lotions and solutions. Contraceptive pills for women. Sotrate or Accutane for severe acne. Accutane and Sotrate have several side effects, including birth defects. Women with severe acne problems that choose these treatments should use alternative birth control. Despite the side effects they have, these treatments are probably the best choice for severe acne. Adult acne treatments. When adults are searching for the best treatments, it all starts with a system. When searching for adult acne treatments that will help you eliminate your stubborn adult acne and ongoing blemish breakouts, you need to look back in your life and ask yourself some lifestyle-changing questions so you can find the best solution for your acne-eliminating needs. When searching for adult acne treatments that will help you eliminate your stubborn adult acne and ongoing blemish breakouts, you need to look back in your life and ask yourself some lifestyle-changing questions so you can find the best solution for your acne-eliminating needs. If you have suffered with acne breakouts your entire teenage years, you may understand what needs to be done for the treatment of your pimples, or you may know exactly the treatment product necessary for elimination and daily maintenance. However, if you had clear skin as a teen, and now that your body is changing due to hormones or pregnancy, you may suddenly experience a change in your complexion and may not know exactly how to handle the new changes in your skin. When your pimple breakouts occur, if you notice you're getting an increase in blackheads and whiteheads in combination to excess blemishes, try to think back and remember how your skin has been in the past. If your skin was clear due to good eating habits, low stress levels, and you were getting at least 8 hours or more of sleep prior to getting your adult acne, then that's the first place you want to start. For example, as a teenager, if you slept more than 8 hours a day, drank plenty of water, and you ate more vegetables and fruit, and now as an adult you only get 4 hours of sleep, you drink less water, and you're not eating the same level of fruits and veggies, then you may want to adjust these areas first. If you change these habits, and notice no change, you then have to go to the next step, and make an appointment to see a dermatologist. When all else fails, visit a dermatologist to get the bottom of your adult acne issues. If you can't figure out why you're still having skin problems after you made necessary internal lifestyle changes, then you should see the skin professionals to find out what's causing your stubborn adult zits, and you may be enlightened once you visit your local dermatologist. Depending on the severity of your skin condition, you may soon find out the condition you have is caused by several circumstances. For women, acne and increased blemishes can be easily caused by hormonal changes due to pregnancy. A woman that is pregnant will have to look at alternative safe skin programs, and natural skin products would be a place to start. Women with hormonal changes that are not currently going through a pregnancy can look at other options such as oral acne medication or antibiotics, but keep in mind that this method should not be a long-term solution, so if you can avoid internal medication, look at other alternatives. Men are somewhat different, and in most cases, increased acne causing a blemished complexion could be the lack of facial care, or mental stress in your life. For men in general, a good blemish cleansing and facial exfoliating routine combined with a healthy diet are the first steps to follow. However, we encourage that men see a skin doctor to assess their adult skin problems. Acne and aging is a complex situation, and there is never one solution to every individual adult suffering from pimple breakouts. There are many contributing factors such as your body's changes during puberty, and for women, even the type of cosmetics you may be applying to your face. Your facial skin consists of thousands of pores, follicles, skin and oil. Any negative balance, and you have a recipe for facial infections, plus outbreaks that can lead to many skin imperfections and severe scarring for a very long time. We touched briefly on what may contribute to your adult acne, and some of the changes that may be occurring in your body internally and also externally. Now, to find out how you can start a program to eliminate your adult blemish problem, I encourage you to read our article on where I break down some of the top adult acne systems that target stubborn facial and body acne.